Hi, my name is Connie. Today I'm going to talk to you about physician-assisted suicide. In Ohio, the state Supreme Court ruled in October of 1996 that assisted suicide is not a crime. This is via euthanasia.com. Dr. Kevorkian was convicted March 26 in 1999 by a jury of his peers for second-degree murder. On April 14 in 1999, he was sentenced, according to the New York Times, published on 4/14/99 by Dirk Johnson. Physician-assisted suicide is when a physician actually prescribes a medication to a patient that is already terminally ill that they can take and go home and end their life sooner and end the suffering. 34 states have statutes explicitly criminalizing assisted suicide. 9 states criminalize assisted suicide through common law. 3 states have abolished the common law of crimes and do not have statutes criminalizing assisted suicide. Those are North Carolina, Utah, and Wyoming. It is only legal, however, in Washington, Utah, and Oklahoma. Virginia currently does not have a clear law stating whether or not physician-assisted suicide is legal or is a crime. Most patients that seek physician-assisted suicide have a terminal illness, whether it is cancer, a neurological disorder, AIDS, sometimes some severe mental health issues. Those patients will seek physician-assisted suicide, but usually are not granted it. In the state of Oklahoma, a patient seeking to obtain physician-assisted suicide must have a terminal illness documented by 2 different physicians, stating that they have less than 6 months to live. They must verbally ask a physician twice, 7 days apart, and then 7 days from their last verbal request, put it in writing to the physician, again requesting that they would like the medication to end their life and as to why. The physician then has the option whether or not the physician would like to participate and give the patient the medication. Typically then the patient would take the medication home, administer the medication to themselves, and pass away. In 1996, 156 patients requested it and 38 received the prescription. 21 died as a result. 58 patients who requested euthanasia and 14 received paternal medication and died. There are risks, of course, with the medication as well, that it's not always completely effective. There was a case in the state of Oklahoma in 1994 where a patient took the medication and managed to survive for 3 months in a coma and ultimately died of pneumonia. Typically, these patients have had a lot of suffering. The idea of physician-assisted suicide is based that who has the right to determine how long or how much suffering somebody else should endure. If a patient already has a terminal illness and they're already suffering, they're in chronic pain, is it their right to decide when to terminate their life and to have the right to die with dignity? Each of us has the right to choose how we live. Should it not also be our right to choose how we die? There's a lot of current legislation going around trying to convince the rest of the states that this should be legalized. It actually is something that's been ongoing for years, even here in the state of Ohio. The majority of states offer hospice services through different organizations. Those hospice services will frequently administer medications that don't necessarily kill the patient, but might ultimately speed it up. It's frequent practice for hospice physicians to prescribe morphine. That morphine given about every 2 hours actually slows respirations. By slowing respirations, you are decreasing the amount of oxygenation in a person and therefore causing them to die a little bit quicker than they probably would have, as well as stopping the pain from whatever disease process they may have going on. Personally, I do believe that that is a humane way to go. We euthanize our animals if they are suffering, if they've had a broken leg. We don't make them suffer for months to potentially years. We ultimately euthanize them and put them down. Why is it not humane to allow a person that's in their right mind to choose to do the same if that is what they would rather do? It also saves the family a lot of hardship of not having to deal with them shooting themselves, jumping off of a bridge, or doing other ways of killing themselves that might be more traumatizing not only to the patient but to the family as well. This is something that then the patient's usually able to discuss with their family and to make their family aware of where they stand, what their wishes are, what they want, and why they want that. And as I said previously, to allow them the right to die with dignity. Thank you.